week's segment of Wellness Wednesday, we continue to raise awareness about American Heart Month and promote cardiovascular health. And we are joined by Dr. Kartik Prasad, a cardiac electrophysiologist. How are you doing?
I'm doing well, Tanya. Thanks for the invite. Glad to be here.
And thank you for joining us. So tell us, what is a cardio electrophysiologist?
We get asked often. I'm a cardiologist, but in addition, I've done a subspecialization in the heart's electrical system. So we primarily treat heart's irregular heart beating and heart rhythm disorders.
And when it comes to the heart disorders, of course, we are talking about AFib.
True. Of all the different kinds of heart rhythm disorders, AFib or atrial fibrillation is the most common. An estimated 5 million adults in the U.S. are having atrial fibrillation. So I think it's a very good idea to raise awareness about it, to recognize it early and treat it.
Now, when it comes to the causes of AFib, what are the 6 key causes that you, based on your profession, sees that is causing this?
Yeah, in terms of causing AFib, we don't necessarily pick one common thing, but it's usually a constellation of things that go along with it. High blood pressure used to be the most common denominator among most patients with AFib. If you have other kinds of heart disease, such as heart failure or blockages in your heart arteries, they're another common cause. In some people with high functioning thyroid gland, we call it hyperthyroidism. That's a common cause for atrial fibrillation. In addition, obesity, which is a big pandemic in the United States right now, it's a common cause for AFib. Excessive alcohol intake and advancing age. If you are over the age of 80, there's a 10% chance you will have atrial fibrillation.
And when it comes to symptoms, what should people look for?
Yeah, majority of the patients do have some form of symptoms. The most common is heart racing. They feel their heart beating fast. We call it palpitations. A lot of individuals experience shortness of breath. Stuff they do on a regular basis, now they try to do, they're out of breath. Some people have chest pain or chest discomfort. Some people even feel dizziness or lightheadedness. There's a different versions, and there are a very small fraction of people who might not experience any of these.
Okay, and when it comes to treatment, how can you treat this?
Yeah, there is no 100% cure for AFib, but medicine has advanced significantly. There are a lot of things you can do to kind of treat AFib. Main part of treating AFib is stroke prevention. That's the major complication of AFib. And with regards to preventing stroke, we use medications called blood thinners. They help to thin the blood and decrease an individual stroke risk. With regards to treating the symptoms itself, there are plenty of medication options and also a treatment option called ablation, catheter ablation. Both of these are fairly effective treatments. Once again, they don't 100% cure your AFib, but they can decrease the frequency of your symptoms and improve your quality of life.
And when it comes to lifestyle changes?
Absolutely. We get asked this often. Most individuals in the office ask, what can I do to control my AFib? Weight loss is a big plus. Thankfully, there's plenty of advancement in weight loss, but weight loss, regular exercise, and cutting down alcohol intake, these are some things that patients can do to improve their AFib.
All right. Well, thank you so much, Dr. Prasad, for joining us this
Enjoyed
afternoon.
it. Thank you.